Hi, I'm Dr. Angela McKaye, chiropractor and naturopathic physician, and it is Tactical Thursday, so I want to give you some tips that have helped a lot of my patients deal with SIBO, because that's what we're talking about this week. So one of the most important things from the outset, make sure that you're ruling out all the other stuff and that SIBO is actually what you're dealing with, because you're not going to get better if you're treating the wrong thing. When you have a diagnosis of SIBO, you want to make sure that you're preparing. So probably one of the biggest things with SIBO is that you have to switch your diet into something that's not going to feed the gut bugs. This requires some planning. So you have to meal plan ahead, you've got to shop ahead, and you've got to be prepared with the appropriate foods so that you're not getting hungry and uncomfortable and then going off the diet and allowing those bugs to sort of get the fuel they need to have a nice bloom in your GI tract. So some planning has to go into it so that you have the appropriate food to fuel you and not your bugs. One thing that can be really helpful is something called the SIBO app, and that's just the name of it. So go to your app store. You should be able to find the SIBO app in either of the app stores for those. You want to pick a diet that seems like it's going to work well for you. So we've listed some of the diets available, and go through the foods and pick out the things. By now, if you've had this for a while, you're going to know kind of which foods set you off and which foods you tolerate better. So you can go through the different food lists in each diet and pick foods that seem to be more in line with what you tolerate well at this point. There is a colleague of mine who has the website SIBOinfo.com, and that's SIBO info.com, and Dr. Seebecker there has all the different types of diets that are recommended for SIBO, and she'll have pretty extensive listings. Sometimes she cross-references them so that you can see which foods are in common for each thing, and that can be really helpful when you're trying to decide which diet to follow. As you're going along on this process, it may be early on very tempting to stick with a few foods that you know upset you the least, and I found that that's how people often start, and they're afraid to incorporate any more foods from the approved list within their diet, and they come in saying, I'm so sick of chicken and white rice and broccoli, or chicken and white rice and whatever. So I encourage you to explore as many different foods as you can on the approved food list for the diet that you're on. So get creative, have some fun. Probably up till now, food prep and eating was just nothing but stressful because you knew you were going to have symptoms. But as you start to feel better, start branching out a little bit within what's approved for your diet plan and seeing what you can tolerate and getting as much variety as you can so that you can enjoy eating again, hopefully without having symptoms. Along with herbs, I almost always recommend a prokinetic. So something to keep the food processing going along down the tube the way it's supposed to. Sometimes this can be as gentle as ginger tea. So ginger is antimicrobial, it's antiviral, and it works as a prokinetic. It can be anti-nausea as well. And so it may not be enough for some people with SIBO, but if you like the taste of ginger, it can be very soothing, both to your GI and to your psyche. When you're going through this process, know that the die-off from treating SIBO, that killing off the bad gut bug thing, takes anywhere from 6 to 8 weeks, and it may take that a couple rounds. So once you get through that die-off phase, it's really essential. You can't just kill the bugs and then move on with life. You need to go through a healing phase. So you're building up the lining of the gut, and you're doing everything you can to heal the tissue there so that you don't have a recurrence. And that lasts another 2 to 3 months. That's about 3 months is about how long it takes for the cells of your GI tract to turn over. And then from there, you have a maintenance phase, which can be anything from like, woohoo, do whatever you want, to really just monitoring and expanding food very gradually and seeing what you tolerate and how much, and coming up with a lifelong plan that allows you to eat as many different varieties of food as possible. All right, I hope that gives you some guidance for treating SIBO or living with it, and I will talk to you in the next video.